We are so pleased to see such a wonderful turnout to be able to introduce this new program to you. My name is Paige Piper, and I'm the Executive Director here at BraveBe Child Advocacy Center, and I've also had the privilege to serve as a co-founder for the Brave fACEs program. So I'd like to start by sharing a story with you. In 2006, BraveBe served a 15-year-old girl named Willow, who came to us for allegations of sexual abuse by a family friend. During her time with us, Willow bravely participated in a forensic interview, where she shared her truth of years of sexual abuse. She received a medical evaluation and ongoing care, and was supported by a family advocate who connected her and her mother to therapy and helped them navigate the complex criminal justice system. Her case led to her perpetrator's conviction and sentencing, and at the time, we believed that we had done everything we could to help her. Fast forward to 2015, when we met 3-year-old Bree, who came to BraveBe after experiencing sexual abuse by her mother's boyfriend. As our forensic interviewer walked into the room to meet Bree's mother, she was stunned to see Willow, now a young adult, sitting in front of her. Less than a decade later, we found ourselves serving a second generation facing similar trauma. We realized that despite our growth and the strides that we had made, there were critical things we missed when serving Willow in 2006. While we focused on the immediate trauma that Willow faced, we later learned that she had also endured emotional abuse, physical neglect, parental substance abuse, and the incarceration of her father. Without addressing the broader scope of trauma, we had not helped her heal from all that she had experienced. Both Willow and Bree are examples of how adverse childhood experiences, or ACEs, affect generations. ACEs refer to 10 potential types of trauma that may be experienced during childhood that can be categorized into 3 buckets, including abuse, whether that be physical, sexual, or emotional, neglect, either physical or emotional, and household dysfunctions, such as a parent experiencing mental illness, substance abuse, intimate partner violence, divorce, or incarceration. Expanded research now includes factors that cause toxic stress, such as poverty and systemic racism. ACEs can profoundly impact a child's development and are linked to lifelong health issues, such as chronic disease, mental health struggles, and a reduced life expectancy. ACEs are scored on a scale of 0 to 10, with the higher the number of ACEs, the more likely someone is to experience adverse health outcomes. In fact, without intervention, with an ACEs score of 4 or higher, we are 3 times more likely to experience lung disease, 4.5 times more likely to develop depression, 14 times more likely to attempt suicide, and 11 times more likely to use intravenous drugs. Moreover, those of us with a score of 6 or higher, on average, will experience a decreased life expectancy of 20 years. And while these numbers are staggering, ACEs are preventable and meaningful interventions exist. The Center for Disease Control and Prevention provides a roadmap of 6 evidence-based strategies to prevent ACEs, ensuring a strong start for children with access to family supports and quality childcare, strengthening economic security for families, connecting youth with caring adults and activities, teaching skills that promote emotional intelligence and safe relationships, promoting social norms that protect against violence, and lessening harm through access to primary care and trauma-informed services. These strategies foster positive childhood experiences which can buffer and protect against trauma. Today, I'm proud to introduce to you Brave fACEs, a prevention program that aims to educate our community about ACEs and advocate for evidence-based prevention strategies to break generational cycles of trauma. Our mission is to promote healing, build resilience, and prevent future harm by raising ACEs awareness and equipping the community with trauma-informed knowledge. We envision a community that asks, "What happened to you?" instead of "What's wrong with you?" And most importantly, a community that asks, "How can we help?" We imagine a community where trauma stops with Willow, and we never see Bree walk through our doors. Brave fACEs is proudly supported by a multidisciplinary advisory board that represents members of our medical community, including our hospital systems, pediatric care providers, and mental and behavioral health providers, victim services providers, early childhood education and development, school systems, the Department of Health and Human Services, the Lancaster County Health Department, many partner nonprofits and funders. If you are a member of our advisory board, would you please raise your hand to be recognized? Just a moment. Together, we have created a 5-pillar strategic plan to help guide Brave fACEs efforts, specifically focusing on a call to action campaign to educate key audiences like early childhood providers, medical and mental health professionals, parents, caregivers, and community leaders about ACEs. An ACEs training plan offering trauma-informed courses and community education. Collecting ACEs data to track community awareness and inform health priorities. Building community partnerships to raise ACE awareness across sectors, and developing a community response system to support early intervention and trauma-informed care, including screening for ACEs to improve our early detection efforts. None of this work would be possible without the support and the financial backing of our community. And I'm thrilled to announce that Brave fACEs has been designated as a Community Health Endowment Legacy Project, highlighting CHE's dedication to our goals and their ongoing investment of staff time, resources, and encouragement of others to support this initiative. CHE was our first partner in developing Brave fACEs, standing with us from the initial brainstorming stages to this very announcement today. Their belief and our vision is reflected in this legacy designation. I also want to take a moment to recognize CHE's incredible leader, Lori Seibel, for her vision of an ACEs-aware community and her commitment to nurturing that vision as we developed this program over the past 2 years has made all the difference. As Lori prepares to retire, we celebrate her as Brave fACEs becomes not just a CHE legacy project, but a lasting part of her legacy as well. We also extend our appreciation to CHI St. Elizabeth for the Mission and Ministry Grants, which has provided the critical support we need for this initiative. Their commitment shows the strength of our community's belief in the mission of Brave fACEs. Finally, I want to acknowledge Maya, the forensic interviewer who worked with both Willow and Bree, who is now leading our Brave fACEs program. Maya, your dedication is invaluable, and under your leadership, I believe that we will truly build a trauma-informed community. We are honored to lead this important work in developing a trauma-aware, resilient community and invite all of you to join us in understanding and preventing trauma. Together, we can create a supportive environment where everyone in Lincoln has the opportunity to live, work, and thrive. We have information packets available on the table in the back, and we encourage you to stay engaged with this project as it grows and develops. One simple way you can do that today is simply by following us on social media at BraveBe CAC. Now I invite you to please join me in welcoming Lori Seibel, President and CEO of the Community Health Endowment.
Thank you. That was very kind. Good morning, everyone. And what an exciting day. You know, this all began for me probably more than a decade ago. I was at a conference in Colorado. I had heard Dr. Nadine Burke-Harris speak. And for those of you who know, she was one of the very early champions of the topic of childhood trauma and its effects over the lifespan. And after I heard her speak, I began to do my own research and read about this work, look at places like Harvard, who has a whole incredible body of knowledge around this work, around Kaiser and the work that they were doing. And then I began to talk about it in the community. And I will tell you, I'm not an expert, but I knew that there was something here that our community needed to know. And so for the last 10 years, I've spoken to thousands of people, and I always take a moment to talk about childhood trauma, about brain science, and about ACEs. And I can tell you this, it's been really extraordinary because as I talk to whatever the audience, if I am talking to teachers and health professionals, I see this very slow nod of understanding. If I'm talking to policymakers or mental health providers or substance abuse providers, I see this very slow nod of understanding. If I'm talking to parents or grandparents, really any audience that I've talked to, there's always just this very slow nod of understanding because It may not be a well-recognized name. We maybe had not quite got our hands around it yet, what it was, what ACEs were, but people knew it. They saw it. They experienced it in the people, in their own selves and in the people they worked with. And more importantly, time and time again, people said, what are we going to do about this? And so I have asked myself through the years, in those early years, I said, what if Lincoln went all in on brain science? What if we became a leader in the entire country about what early childhood trauma means to kids, what it does to kids, and how it affects them as adults? If anyone can do it, Lincoln can do that. And so I began looking for partners in this work. I ran into a number of dead ends, I will tell you that. But then I met Paige. I was trying to remember where we had coffee the first time. But as we talked, I think it took her maybe 15 seconds to say yes. And she said she said yes to a number of things that day. She said, yes, ACEs do matter. She said, yes, ACEs should be a community priority for us. She said, yes, BraveBe is on board. And then she said, yes, let's get started. That was it. And so now you've heard about all the work she has outlined that's happened over the last 2 years. There has been travel and meetings and research and learning and dialogue and partnership building. So many people, many of you who are in the room, have come around the table to talk about this important topic. And all that work has brought us to here today. Lincoln has now set itself, I believe, in the upper tier of communities who are committed to addressing this incredibly important problem and to prevent the root causes of why it happens to begin with. Brave Faces is not just an intervention program. It is a prevention strategy that will change our community for the better and for generations to come. You know, it is not going too far for me today to say that less than 6 weeks from my retirement from this position, that this is a dream come true for me. I said I wouldn't do this. We are so proud of this work and this vision that the Board of Trustees did give this a legacy designation. It is one of only 5 we have ever given in our 27-year history. So I cannot thank the CHE Board of Trustees for recognizing the important work led. You'll hear today from Marilyn Moore, our board chair, from the very beginning. I want to thank Emily Kluver. Emily, if you'll wave your hand, she assumed the staff leadership role for Brave Faces, and she'll continue to do that into the future. I want to thank CHI and St. Elizabeth for coming alongside us and supporting this work. It's incredibly important. And of course, I want to thank BraveBe, Paige, Maya, all your team for not only stepping up, but leading forward. All I can say today is thank you for letting that dream come true, and I can't wait to see what happens. I want to introduce you to a CHE board member, but today here as the president of CHI St. Elizabeth, Tyler DeYoung.
Lori's a pretty tough act to follow, but I'll do my best. So, on behalf of CHI Health St. Elizabeth, thank you to the BraveBe Advocacy Center for having us today and the Community Health Endowment for this amazing partnership. CHI Health St. Elizabeth is incredibly proud to support Brave Faces project, which will allow for community education, awareness, and action to improve the lives of our kids. CHI Health St. Elizabeth sees young patients every day, whether it's in our pediatric emergency department, our NICU, our labor and delivery unit, and we care for these patients from the very first days, and we're there for them as they grow. Our healthcare providers see firsthand the impact of adverse childhood experiences can have. It can be heartbreaking, and research shows these traumatic experiences have a lasting impact for years to come. At CHI Health and our parent organization, Common Spirit Health, it's our mission to improve the lives of the people we serve. That's why we feel so aligned and passionate about supporting this project. Brave Faces will provide additional training and great access and resources to our entire community, including our healthcare providers. to better recognize the signs of abuse, neglect, and other traumatic events, and let us know how to intervene. In healthcare, we always train for these situations, but the additional resources and support will allow us to make an even greater impact. Thank you again to BraveBe for leading this incredible project, and we're proud to partner and support our community. Together, we can make a difference for our kids and our community, enduring a brighter and better future for all. With that, I'd like to invite Tom Beckius up to give some remarks.
Good morning, and thank you, Tyler. I appreciate that. A few folks I want to recognize here this morning before we get started. I'd like to start with one of our largest community partners, and that would be Lancaster County and, of course, Sheriff Wagner. Sheriff, thank you for being here today, and thank you for serving on the board of this fine organization. And I would also like to take a moment to recognize on the city level the Lincoln Police Department Special Victims Unit that are here today. Thank you very much for being here, and thank you, of course, for all of the work that you do day in and day out. Well, on behalf of the city and on behalf of Mayor Leary and Gaylord Baird, welcome everyone today. I'm honored to be joined here by some dedicated professionals and, of course, our community partners along the way as well. We are here today to mark the launch of a truly transformative initiative for the Lincoln community, the Brave Faces program. As someone who was born and raised right here in Lincoln, I've always believed that Lincoln's greatest gift are its people, the families and the neighbors and the community partners who work each and every day to lift each other up and to create a place where everyone can thrive right here in Lincoln. This belief is at the heart of the Brave Faces program, which aims to address one of the most critical challenges of our time, the impact of adverse childhood experiences. And this is actually something that I've heard about via Lori Seibel for about 10 years now. She's correct. That's absolutely right. Research shows us that ACEs, events like abuse and neglect or household instability, can have long-lasting effects on emotional, physical, and mental health. But it also shows us something else, that with the right support, that healing is possible and that resilience can be built. Today, we as a community, thankfully, because of BraveBe, we take a big step forward by launching Brave Faces, a program designed to ensure that every child and family in Lincoln has access to the resources that they need to overcome adversity, because we can't always prevent that, and that we can teach people how to thrive. This program not only brings much needed attention to the impact of ACEs, but also builds those bridges that we know that we all need between healthcare providers, educators, social workers, and community advocates. None of this would not be possible without the powerful partnership between BraveBe Child Advocacy Center, the Community Health Endowment of Lincoln, and Catholic Health Initiatives. Together, these organizations exemplify what we can achieve together when we put together our heads for a common purpose. This program is not about just addressing challenges, but it's about creating opportunities. Opportunities for children in our community to grow up where they feel safe and supported, and for families to access the tools that they need to succeed, and for our entire community to benefit from the thriving potential of each of our individual children. The Brave Faces program is a testament to what we can accomplish when we come together for a common good. It's an investment in our most precious resource, our people, and a promise that no one in Lincoln will face adversity alone. Let's continue our work together, even after today, to build a city where every child, every family, and every individual can realize their fullest potential. Thank you all, for everyone in this room, for being a part of this journey. And thank you for making Lincoln, for your dedication in making Lincoln one of the best places to live, work, and play in the United States, and the quality of life capital of the world. With that, I would like to hand this podium over to a longtime Lincoln educator. As mentioned previously, the current board chair of the Lincoln Community Health Endowment, and an advisory member, an advisory council member as well of the Brave Faces program, Dr. Marilyn Moore.
You'll see that I am the one approaching the podium with no notes. And that's because my assignment is to wrap it all up, which means I've been listening carefully, thinking about the strands that draw the comments together that such wise and brave leaders have made, and thinking about what I might add to that and send us off on our way with a full heart. And as I do that, I'm thinking about the little ones in my family, great nieces and nephews. They are 9, 8, 7, 4, and 2. And we just gathered last weekend to celebrate the oldest child's birthday. Keller turned 9. And I'm reminded that when Keller was born 9 years ago, a few months after she was born, I wrote about her and I said she is the most blessed child because of what surrounds her. She was born to a mom who had adequate and complete prenatal care. She was born into a stable family that has a safe home where she lives. It is heated in the wintertime and cooled in the summertime. There is adequate nutrition. There is safe drinking water. There's grass on the front lawn, which means there's not dirt, and so there's not dust in the air that she breathes. She's had every well baby checkup that she should have. She will have all the vaccinations at all the appropriate times. She's been read to since the moment she was conceived, and that continues to this day. She has an extended family of grandparents and aunts and uncles who love her dearly. She will go to school in a community that cares enough about the education of their children that they're willing to pay the taxes to make a quality education appropriate for her. And she grows up in a community that if there's a problem, there are some community resources that will help support that family. Those are not extravagant gifts. Those are the essentials for well and healthy children. And if I want that for Keller and for her younger brothers and sisters and for her cousins, I want that for every child in this community. And I think this room is filled with people who want that for every child in this community. A number of years ago, when I was still working with Lincoln Public Schools, I was at a dinner one evening, and one of the persons who was at the table, a bank officer in a leading bank in this community and a community leader himself, said to me in one of those kind of curious about my answer, but also interested in starting a conversation at the table, "So, Marilyn, in your perfect world, what would you do to make schools better?" And I'm sure he was thinking that I would say something like pay teachers more, or have smaller class sizes, or a longer school year, or more opportunities for extended activities for kids. And all of those are really important. But what I said was I would invest in young children and their families. And he said, "Really?" I said, "Yeah, really. I would invest in young children and their families, and especially in quality preschool education and quality childcare for every child." And he said, "Tell me about that." And I said, "Well, what I can tell you is that children who grow up in stable families, children who grow up with adequate food, children who grow up with adequate medical care, children who grow up knowing that they are loved and cared for and they're not anxious, are children whose brains develop and who are going to be really good learners when they come to school because they've been really good learners since they were born." And that's what I would invest in. And when I talk to service groups and they say, "What can we do about helping schools?" I said, one of the biggest things you can do is just look around, and when you spot a family that needs some help, help that family, because that helps that child, and that helps everybody that comes in contact with that child. When I think about upstream work, which is what this work is, it's trying to address those trauma situations before they become trauma situations. And it's really challenging work. In some ways, it's hard work in that it's hard to measure. You don't know if prevention works other than looking at broad outcomes. But what I can tell you is, actually, we do know that it works. We know that things like childhood vaccinations make a difference. Children are healthier because of that. We know that things like early childhood special education make a difference. That if you don't wait until a child's 5 to start helping that child learn to speak, that child has a better start at school. There are all kinds of things that we know make a difference when you invest in the upstream, when you invest in the circumstances that start children off. And that's what this is. This is upstream work. And I'm really glad that BraveBe Child Advocacy Center gets to do this work, because they see every single day the children who walk through this door that didn't have the upstream work, and they know how hard that is. Every time I come here and I listen to any staff member, and it doesn't matter what role that staff member's in, they just talk about their day, and I think, oh my gosh, you are doing such hard work, and work that is emotionally wrenching. And if it's hard for me to listen to it, I cannot imagine how hard it is for that child or that adolescent to live it. So when we do upstream work, and when the staff here gets to engage in that upstream preventative work that isn't the crisis at the door at the moment, it's preventing the crisis 10 years down the road, how rewarding it is to do that, and how important it is to this community to do that. Because when we do that, we increase the likelihood that all of the children, mine, yours, this community's children, grow up and live into their full potential and their full promise, and that strengthens all of us. And so I'm glad to be here today as we launch Brave Faces. Thank you for being here.
I would just like to close by once again thanking all of our phenomenal partners and speakers who joined us this morning to share more about their role in bringing this project to life. Marilyn, I hope someday I can come up to the podium and speak without notes the way that you just shared that message and story. I have a new life goal in addition to this project. We would now like to open it for any questions that anyone has.
What are some of the more like specific ways that you're going to kind of educate the community, or like some of the resources that people can access with this program?
Absolutely. Excellent question. So 2 of our specific pillars that we've outlined in the Brave Faces program, one looks at a call to action community campaign. And so we are actually right now in the middle of developing out a comprehensive community strategy for community education and awareness around ACEs. Because we believe that ultimately we have to be aware that this is a real issue impacting our community to begin to work together collaboratively to address that issue. So keep your eyes peeled for much more to come on that Brave Faces awareness campaign that we hope to have a very broad stroke out to our community with. The other component of that strategic plan looks at a training program and platform. As a component of that, we've developed a handful of curriculums from Trauma 101 to 201, where we're working with identified community partners within that target demographic of folks who are working with early childhood as well as medical and mental health professionals, schools, et cetera. Those curriculums are a fantastic opportunity to learn about brain science and understand how we can start having an impact on young children. But in addition to that, we also developed a curriculum called Building Resilient Families, which is a curriculum that's currently hosting its very first pilot program at Belmont Community Center, where we're paying parents to come and to learn about how do you implement strategies in your own household to develop healthy attachment with your children. It also provides childcare and a warm meal, so it's a chance for those parents to be able to lean in and have the time and space to develop a cohort to learn from others as well as identify strategies to impact in their own home. Really, this work starts with your house. It starts with one family and then broadens to our community. Yeah.
I have a question for Lori. You sort of touched on this in your speech, but you mentioned that this is a legacy project. Could you dive in a little bit further about the significance of designating it a legacy project?
You bet. The Community Health Endowment has funded hundreds of projects through the last 20-some years, and it's often done through a competitive grant-making strategy. But oftentimes we know that there are issues which are far-reaching. They're going to involve a number of partners. They may be something that is emerging as an issue. There may be something that we need to continue to convene the partners to bring it together into fruition in the long term. And over the years, we have found that there are projects which just take longer. They need to have leaders emerge. They need to have a continual set of a body of knowledge to help them become the best possible project they can be. So we've committed to saying we're going to stay alongside them. We're going to help grow, support, encourage that project as it moves through. And so we've been working with this project for a number of years, providing funding so that these folks can travel around the country and look at exemplary programs elsewhere, where they have been able to form an advisory committee that fills in the gaps of perhaps some of the expertise that they may not have here, although you have a lot of expertise, but there are areas where they don't, bringing together folks. And so it is in some ways a bit of a movement, these legacy projects, where we're trying to create a movement around a particular topic, culminating with really a far-reaching initiative. And so we never promise money, for example, when we start these legacy projects. Often they end that way because of all that we've seen that's happened. But legacy projects to us mean that they're here for the long term. You're going to see these programs make impact for generations to come. They're going to leave a legacy. And while we fund a lot of great programs, these set themselves aside as something that are transformative for our community in many ways. So I hope that helps.
Additional questions? Okay, well, we will stick around here for just a little while, so if there are any follow-up questions or any information that you would like, please let us know. Again, there's information on the back table, so we encourage you to take some of our Brave Faces materials with you and share those with just one other person. Our ask is always share with one person what you learned today, and we hope that you will continue to stay engaged as this project continues to grow and thrive and become a staple of our community. We thank you so much for your time, and again, we will be around if there's further information you'd like.